There's encouraging news regarding the treatment of inflammatory bowel disease, which includes a number of conditions affecting the digestive tract. And joining us now is Dr. William Fabian. He's a gastroenterologist at Mayo Clinic, Arizona. Good to have you here. Thanks for joining us.
Thank you so much. Good to be here.
Let's define terms. Inflammatory bowel disease. That's more than one. Is that like more than one disease?
Right. It's probably many diseases depending upon the genetics, but right now I think most people would describe it as a basket of two diseases. One would be Crohn's disease and the other is ulcerative colitis, defined almost by their behavior and where they're expressed in the bowels. So Crohn's disease can involve anywhere from the mouth to the anus, whereas ulcerative colitis by definition only involves the colon.
Okay, so these are things that can't be cured, or what?
Right. So the way we tell patients now and the way I talk to my families are that as of today, in order for us to control the disease, not just the symptoms, but actually all of the lesions that you could see on endoscopy, most patients require therapies for an extended period of time. So in that way, it's incurable. However, most patients will live a long, healthy lifetime with the disease, more like blood pressure problems than it would be.
How is it diagnosed?
So diagnosed many times, patients have the right symptoms, patients may have the right blood work, they'll come see either their family physician or maybe get referred to a gastroenterologist. Most diagnoses are made by two things. One would be endoscopy, so passing a lighted tube either through the mouth or through the bottom to take a look at the entirety of the GI tract. And there we can see the lesions through the scope and also take a look at it on biopsy. That, and there's also very suggestive x-ray findings.
Yeah, okay. So the treatment for this is, correct me if I'm wrong, wasn't this something where you'd have to kind of go in and get some sort of infusion every few weeks or something like that?
Right. A lot of the modern therapies are delivered by vein. Those would be the so-called biologics. But we've known about this disorder for really almost 80 years, and treatments have gone anywhere from classically oral corticosteroids, which are the oldest therapies, through a variety of other pill-based therapies, and now much more recently, I would say ever since really 98 until now, we talk about this family of medications called biologic therapies. So-called biologic because they require a living platform in order to produce them.
Well, that's what I wanted to ask you about, because I was reading about this thing called the living pharmacy within the body. Good. What is that?
Right. So this actually, this was the concept for this came out of one of our collaborators in Mayo Rochester, who were successful in getting an award called an ARPA-H grant, called ARPA-Ease.
Yes.
And the living pharmacy is this concept that we can encapsulate certain cells, little bioreactors. We can encapsulate cells in a membrane such that the body doesn't attack it, place it into a patient, and those cells will produce a biologic therapeutic consistently over time until you have it exchanged. So the living pharmacy would be implanting the cells that make, in this case, it's called an antibody, that's a therapy, and it would make that therapy every minute of every day of the month, every month of the year, until it's either removed or we exchange them.
So that's like a 24/7 infusion then?
Correct. Still very early in the conceptual phases, but it was a grant that was awarded.
And it just generates antibodies to, in this case, fight inflammatory disease?
Correct. This one in particular would bind another protein called a cytokine, which are sort of like text messages for the immune system. They coordinate the immune response.
Okay.
And this one in particular is directed against TNF.
And what is that?
Tumor necrosis factor.
Okay.
It's one of the oldest biologic therapies is targeting TNF, and that's why we feel like that's a good target to go after.
So someone who needs the treatment, instead of going every couple of weeks or going every month or whatever the case may be,
Correct.
this would go in the arm and stay there for how long?
Well, I mean, months, years.
Really?
Right. Now we're still in the early phases of discovery science.
How early are we talking here?
So the cells exist. We've gotten the funding. I think it's been contracted within the last year, and the teams are at work both across the Rochester campus as well as the Arizona campus. But the contracts are usually for 4 years. So if we don't make measurable progress, really in 2 to 4 years, so that's the time scale.
And that award was from Health and Human Services, correct?
It's the ARPA-H, right, from Health and Human Services.
Are
Exactly.
you sure this thing's going to be still there when you wake up tomorrow morning?
The contract still exists, as far as we know.
You never really know about this thing. So when it comes to inflammatory bowel disease and these sorts of Crohn's disease especially, but ulcerative colitis, are you encouraged that this kind of thing and what you've talked about before, are these making a difference in people's lives?
For sure. I mean, I think that the what we would call natural history experiments that have been done over a period of decades would demonstrate that there's fewer patients having surgery. There's much better quality of life in our populations of patients that have these diseases. So I do think we're making a difference. I think really the biggest differences are going to be made when we really understand the mechanisms of every individual patient that has disease.
And last question regarding the cell factory. You know, did you put it in the arm and you just let it go and do its thing?
Sure.
Can that be used for other conditions?
Absolutely. I mean, any disease that responds to a blocking antibody or a monoclonal antibody therapy or other types of biologic therapeutics that are produced on a living platform such as a cellular platform, you could imagine something like this being useful.
Cancers?
Probably, yes. I mean, a lot of our, well, absolutely. So some antibody therapies that are targeting the so-called checkpoint inhibitor therapies, for example, are all monoclonal antibodies. So theoretically, that could go onto this platform.
Wow. So it's pretty encouraging. This is pretty good stuff out.
I think the concept is really cool.
Yeah.
I think the concept of having a living platform that's encapsulated from the immune response that can treat a patient consistently over time is a super cool concept.
So we'll see where the clinical trials go.
We'll see where it goes.
All right, doctor. Good to have you here.
Thank you very much.